In moderate stages of dementia, people may experience the following symptoms: needing additional assistance with reminders to eat, wash, and use the restroom, needing help in recognizing family and friends. Sometimes showing a photo of the person at a younger age will trigger their remaining long-term memory of that person. Wandering, getting lost, hallucinations, delusions, and repetitive behavior. Perseverating on a task, meaning they repeat something over and over. The person feels compelled to do something, such as call a family member, get groceries, or pick up their children. It often is linked to a responsibility they had as a younger person before memory impairment occurred. Hoarding of everyday objects. In a facility, this could be things like sugar or ketchup packets, straws, or salt and pepper shakers. Rummaging through items in drawers. This can be upsetting to others in a facility as the person may likely go into other residents' rooms, not realizing it is inappropriate. Engaging in risky behavior such as leaving the house in clothing inappropriate for weather conditions or leaving the stove burners on. If living in a facility, individuals may try to leave when it is not safe to do so, referred to as eloping. Demonstrating restlessness, agitation, irritability, or confusion that can begin or worsen as daylight begins to fade. This is referred to as sundowning. In the moderate stage of dementia, people who pace or wander may not feel comfortable sitting down for a meal. Finger foods, frequent healthy snacks, and nutritionally enriched beverages can be offered to help maintain their nutritional intake. Those with advanced dementia may experience the following symptoms: urinary and/or bowel incontinence, increasing need for assistance in washing, dressing, eating, and toileting, unsteady gait or shuffling while walking, progressing to the inability to walk, increased aggressive behavior, disinhibition, inappropriately acting on sexual desires, or inappropriate laughing, difficulty eating, swallowing, and speaking. Increased time for processing conversations and following directions, progressing to unresponsiveness. Modified diet such as thickened fluids and a soft or pureed diet. Seizures may develop in advanced stages.